It is Thursday, September 17th. Exactly 6 months ago, I was wearing a St. Patrick's Day tie, and here I am again, and here we all are as we continue with the COVID-19 updates. This is our 130th episode. And yesterday's program, we talked about the second wave. We made the announcement here in Kahnawà before, I guess, most of the other jurisdictions made the declaration. Lloyd Phillips brought that up. He is here today, of course. He is the Commissioner of Public Safety and the head of the COVID-19 task force, and we'll ask him to comment on that declaration. Has it had any effect in Kahnawà, or perhaps were the people here expecting that? Lloyd?
Thank you, Joe. Good afternoon, everybody. Thank you for joining us once again. As Joe mentioned, obviously, I think if you were watching the show yesterday, we officially had made the declaration that we are now in the beginning of a second wave of the pandemic. I know we've been hearing a lot about the potential of a second wave, over the past several months, but again, officially as of yesterday, we have declared that we are at the beginning of a second wave. And at the same time, we also mentioned that how big that second wave will be is still unknown. But one thing we do know is the actions that we take today will greatly impact how big that wave will be down the road. Hopefully, it'll be just a small wave, a small ripple in the pond, so to speak, and we could avoid that major wave that we've seen earlier on this year. And it has been Okay, we're back. We had a little bit of technical difficulties there. Thank you for joining us once again. And as I was saying, we certainly are not pleased that we have to announce it, but we announced it yesterday that we have officially started the second wave of the pandemic. And a lot of the determination on how large that second wave will be, whether it will be a small ripple, so to speak, or will it be a major wave as we've seen earlier in the year, largely depends upon what we do now. Obviously, Kahnawà first and foremost is our concern, but obviously what happens around Kahnawà, throughout Quebec and Canada, and even the U.S. to a certain extent, impacts our community greatly. So I know by making that announcement, it created a lot of anxiety in the community. Even though some people and most people were kind of expecting that to happen at one point in time, it did happen sooner than most people anticipated. We were anticipating a second wave sometime to start in maybe mid to late October, maybe even November. But here we are, a month early at least, and we're seeing all the indications. Quebec, if you're watching the numbers there, have continued to increase dramatically over the past while. And under their system, they have moved nearly the entire province into the early warning or yellow phase and taken it out of the green. So they are watching it very closely as well, and we have to watch what they're doing. But internally to the community, we did receive some feedback over the past 24 hours since the announcement. Primarily, positive feedback, because I think our community understands the situation that we're in as Kahnawà, the vulnerability of our community, and people are pleased that the task force is reacting early to sound the alert and start taking measures to ensure that we minimize the impact of a second wave. So for those people who reached out to the task force to show their support, I certainly do appreciate that. That does go a long way. No, and obviously there's impact on some of the areas I touched on yesterday with the businesses in the community, with the hold on increase in numbers into 50 at any given one establishment or zone if the gaming houses. Obviously, we understand that that there's heartache and there's some hard. I guess decisions they have to make from a business perspective, but again, I do also believe that they do understand the fact that the health of our community, is paramount. Just a reminder: 50 people in one gathering place is the current limitation. 10 people for private residences, and that is not 10 people inside and 10 people outside. That is 10 people, say, on your property, for example. So if you want to have a small gathering at your home for a birthday party or whatever, it is limited to 10 people. And of course, distancing rules, hygiene, and such, do still apply, because those are the areas that throughout Quebec, with the large increase in numbers, it was shown that the problem, is primarily with the private gatherings where people getting together in a household or a small party that people may be having, and then over time, the physical distancing and the measures kind of go to the wayside, and everybody reverts back to the way it was pre-pandemic. That's nobody really necessarily to blame there. It's kind of human nature, but that's where it's been shown has been some of the largest areas of the spread of the virus. So we have to be mindful as a community. We've been lucky. We haven't had any cases in the past several months, but the more we gather and put down our guard and become complacent, the higher the chances are of us spreading and contracting the virus within our community. Actually, tomorrow, just for you're aware, there is also a discussion between the task force members and the education system to go over any final clarifications or questions regarding the reopening of the schools, which is scheduled for Monday. Dr. Gauthier will also be part of that discussion, so we want to ensure that everybody's clear who are involved in the education of our children. And we do feel strongly still, despite we're increasing our vigilance, we are monitoring what's happening, but we still feel strongly that it is the right decision to move forward with opening of the schools. It is important for the social well-being and emotional well-being of the students as well, to get back into a sense of normalcy, get back into the classrooms. It's being done as safe as possibly can. Additional measures are being taken inside the community than have been taken anywhere throughout the whole province of Quebec, or Canada for that matter. So we are confident. Mind you, we are going to keep monitoring it. The education system is going to keep monitoring what's happening, and on a week-to-week basis, we'll see what happens, and if changes need to take place, they will be done quickly and effectively. But again, we're going to base everything we have to do based on the science and understanding that there is a level of anxiety and fear across the community. So rest assured, there's a lot of eyes watching what's happening in that respect, and we'll continue to do so. We are continuing with looking at the next step, if that next step is required. Matter of fact, this to address some of the ongoing issues and ensure nothing falls through the cracks, so to speak. There is an additional task force meeting, which I called for Monday afternoon, as well as our standard one for Wednesday. So next week, the task force will be meeting 2 times to discuss everything that's happening this week, ongoing assessments, what we're going to see over the next few days, looking at what's happening with opening of the schools, getting feedback from the community, from the business establishment and health experts, and deciding where we go over the next coming weeks and months. I'll repeat it once again. At this point in time, we're not here to push a button to say it's a panic mode. Things are still under control. The trend is not good, but if people take measures now, that it could be minimized, and we can curb the spread of the virus once again. So be vigilant. Don't be complacent. We can work our way through this, and we will keep monitoring and take appropriate measures as required. So with that, Kahnawake, be safe, and I'll see you again soon. Onigawahi.
Lloyd, very well put. I just wanted to make a comment. Lloyd was talking about the meetings and the various organizations that come forth, and we're very fortunate here that we have, this is a community organization, and when people call in, you know, people can actually call the task force, and if they need to speak to Lloyd, they can speak to him directly. There is not a big bureaucracy where decisions are made going to 4 or 5 different committees. Decisions get made quickly and effectively and with the right expertise. So just wanted to make that point. Also, Lloyd was talking about the mental health and emotional well-being. That's something we haven't talked about too much on the program. And we're 6 months in, 6 months plus now, and for some, you know, it was very difficult at the beginning and they got used to things. But for others, the length of this is proving to be difficult. And if you're having any difficulty in all and need to speak to somebody, you don't, maybe you're shy to talk to your family about it, you don't want them to see you at what you maybe consider a weak moment. You want to show strength for your family, but you yourself need to talk to somebody. Call Sagot at the Genhas. They're there. They're there actually 24 hours a day. There's always someone on call. You can call them at 450-632-6880. And during off hours, you can call the peacekeepers here, and they'll put you in touch with somebody who can listen to you. So that's just something we wanted to mention. Also, we talked recently about the changes for people who are visiting their loved ones at the Academy Memorial Hospital Center. Remember the changes. You need to call in advance to set up an appointment. That number, as we've said before, 638-3930, and the extension is 2296, and they'll explain everything that needs to be said. With that, we've done 3 programs this week, and hopefully everybody is doing well and will continue to do so. We shall see you next week. Take care. Have a good weekend, everybody. Nyawako Dano Onagiwahi.